Hello, I'm Dr. Erica Armstrong, founder and CEO of Root. In this presentation, we will discuss using functional medicine or root cause medicine to find and treat ADHD. So what is functional medicine? Instead of a conventional route of naming symptoms with a diagnosis and then finding a medication or procedure to match, what we're focused on is finding root causes, or the why behind your symptoms, so that we can optimize your health and brain and body function. This illustrates what we're trying to do. Here we have a leaky faucet, and instead of trying to mop up the mess after the fact, what we want to do is turn off the faucet at the root cause. With mental health, Root can bridge the gap. Although both medication and counseling may be important for you, what Root is trying to do is be the person in the middle that actually focuses on the root cause and addresses things like blood sugar balance, nutrient deficiencies, the gut-brain connection, inflammation, and hormone balance, as these are all important factors to optimize executive functioning or functioning with ADHD. These important factors may not have been addressed for you in the past, include blood sugar balance, addressing if there's insulin resistance as a factor, addressing nutrient deficiencies, and then cortisol, our stress hormone, and how this affects our day-to-day anxiety levels, as well as our sleep. Looking for sources of inflammation that are often found in the gut, and then looking to see if there are any food sensitivities that may be affecting the way that your brain is functioning. Let's start off with the first topic, blood sugar balance. Blood sugar balance is important for everyone. Symptoms of imbalanced blood sugar, especially 1 to 2 hours after eating, include trouble concentrating, food and sweets cravings, food noise, brain fog, mood swings. You'll notice quite a bit of overlap with ADHD symptoms here. To assess for blood sugar balance, these are important lab tests to have completed, and all of these are included in our root cause panel. High insulin levels, high fasting blood sugars, or high 3-month averages of blood sugars or hemoglobin A1C all point to insulin resistance. Insulin resistance affects almost half of us adults, and if you have insulin resistance, it will make it very difficult to concentrate because you will likely be tired and have food noise. The way to describe insulin resistance: insulin's job is to take the sugar in the blood and drive it into the cells that need it, including your brain cells. When insulin is not doing its job well, it cannot bind well, and so more insulin is needed to do the same job. And the sugar is more so staying in the blood than getting into the cells that need it. This creates food noise and sugar cravings. This is how we address insulin resistance at Root, the Root plate. This is a sustainable nutrition method that anyone can do anywhere. Here's a visual of our patented Root plate. In this plate, half of your plate will be non-starchy vegetables. A little less than a quarter will be a starch, and a quarter of the plate lean protein, and then 1 to 2 tablespoons of healthy fat. So this balance of protein, fat, and fiber will promote blood sugar balance, and including most of your plate as vegetables will have different phytonutrients or colors of vegetables that will be helpful for your gut health. Here is a visual difference. You can see the top plate on the right has a lot of starch and a lot of rice, and unfortunately this is how a lot of American plates look, especially if you're eating takeout. What we want to do is shift that. We want to make half of the plate the non-starchy vegetables, a little less than a quarter being the starch, and then 1 to 2 tablespoons of healthy fat. For maybe the avocado oil that the broccoli was roasted in, and for the protein we have the chicken meatballs. Here are more real-life examples of how to do the Root plate. We have chicken, where here sweet potatoes are the starch, and then half the plate being non-starchy vegetables. The next examples, we have a salmon burger, cauliflower, and then rice is the starch. And then we have an egg as a protein in the last two examples. There are lots more of these examples and recipes and meal plans, all developed in-house by our dietitians using our patented root plate method within the Root resources. Now let's move to talking about important nutrients for focus and energy. Iron. Stored iron is ferritin, zinc, omega-3s, B vitamins, vitamin D, and magnesium. All of these nutrients are tested in the root cause lab testing panel. Here's a little more about the root cause panel. This is trusted by our own doctors and dietitians for over 6 years. It tests for nutrients, inflammation markers, energy, metabolism, and more. We do have supplements that have been tried and tested in our practice and measured in lab result testing for efficacy. These are from the important nutrients from the previous slide, if supplementation is needed. The next topic is cortisol, or the stress hormone response. Symptoms of cortisol imbalance are anxiety, trouble sleeping, procrastination, which can also be a sign of anxiety. And again, some of these are overlapping with ADHD symptoms. Fatigue, trouble concentrating, brain fog, forgetfulness, mood swings. So how do we assess for cortisol imbalance? The best way is to actually track your cortisol over the day through a simple saliva test where you spit into a little test tube at 4 points throughout the day, and we can measure both types of adrenal hormones, the DHEAS and the saliva cortisol. We can make sure you have a robust cortisol response to get you going in the morning, and that the cortisol level is gradually declining through the day, so its lowest point is at bedtime so that you can fall asleep. Resources if you have a cortisol imbalance include Root's Limbic System Retraining course, which is found in the Root community. Additionally, we have resources for taking a look at your cortisol test results. When your tests are done through Root, they will also come with personalized doctor insights on your results. There are also adaptogens, which are supplements that may help your body adapt to stress and are available based on your recommendations from your results, as well as part of the membership. The next root cause is a big one, gut health. Research suggests a link between gut bacteria, gut microbiome, and ADHD, and we know that diet and lifestyle and the environment all influence the gut bacteria. Negative examples would be alcohol and sugar disrupting the microbiome balance, and then positive things for the gut microbiome include fiber and those different phytonutrients. And we know that chemicals produced by the microbiome actually affect the way your brain functions and the gut-brain axis. We can take a deeper dive into your microbiome and more functional stool testing, looking for those inflammatory markers and even some markers that affect hormones, as well as some food sensitivities in the GI map test that is available. Root member resources for gut health include digestible videos, meal plans that are gluten-free and dairy-free, and then our gut health bundle to optimize the microbiome and inflammation in the gut. The next topic coming alongside of gut health are food sensitivities. We know from research that certain food sensitivities may trigger ADHD symptoms, including gluten, corn, soy, even artificial dyes or sweeteners. One study found that 85% of individuals who did an elimination diet saw a 50% plus improvement in ADHD symptoms. So that's fairly profound improvement in the vast majority of individuals. A temporary elimination diet may help identify triggers, and support with gut healing can help you be able to get those foods back into the diet if possible. But if you're still struggling with food sensitivities, especially with symptoms like fatigue or brain fog or joint pain or other gut symptoms, we may suggest including a detailed food sensitivity test called MRT. Here's an example report of MRT and the different foods that are tested here and the different levels of reactivity that one may experience. Let's go over a couple of case studies now using a functional medicine approach to ADHD. Here's an 18-year-old male whose goal was to come off of ADHD medication so that he could achieve his goal of being a pilot. His main concerns were that he struggled with putting together balanced meals and sometimes forgetting to eat that led to blood sugar balance concerns. He also experienced difficulty with sleep, so the first intervention was ordering a root cause panel to identify nutrient deficiencies, which can be very common if you have sporadic eating habits. We taught him balanced blood sugar strategies, including the patented root plate method. He also used some sleep apps that helped him with his sleep and used some targeted herbal supplements while we were retraining his sleep habits. He corrected those very important nutrient deficiencies, learned to make balanced meals, and with sleep improvements, he was able to successfully wean off his ADHD medication and pursue his pilot career. Here's another case. This is a 35-year-old executive who is struggling with difficulty focusing, brain fog, and this general feeling of life overwhelm. She had gone to her PCP with these complaints and ADHD medication was recommended, but she wanted to explore alternative avenues to address these symptoms. We did a cortisol test for her to assess stress levels, and based on those results, we used targeted stress management strategies when we found the highest points of cortisol throughout her day, and some adaptogens as well as blood sugar balancing diet, which were all very important for the cortisol response. She experienced significant cognitive function improvement, better sleep quality, stress reduction, and allowed her to manage her symptoms without the need for ADHD medication. Let's put this all together in a functional medicine plan for ADHD. The first thing to start with is getting the right data, and so starting with a root cause panel. This is a blood test that is drawn nationwide at Quest Labs, and you can use those results to target nutrient supplementation, then use root plate recipe guides and resources in the community to balance your blood sugar. You can also get started right away with limbic system retraining course. And if you went through all of that and wanted to take a deeper dive, the next recommended tests would be cortisol testing, potentially gut health testing, and if you're having gut symptoms or concerns for food sensitivities, an MRT test can be helpful. So this is a wellness plan including nutrition, stress, sleep, supplementation, and testing that you can access all of these steps through the Root membership and resources.